afraid of H3N2 virus? Let's see what is H3N2 virus. The H3N2 virus is a subtype of the influenza virus, which is a highly contagious respiratory illness that can cause mild to severe symptoms in humans. The H3N2 subtype is a strain of the influenza virus that has caused several flu pandemics in the past. Let's see what is influenza A and what is meant by subtypes of influenza A. Influenza virus is a respiratory virus that can cause seasonal flu epidemics and occasional pandemics. Influenza virus is highly contagious and spreads through respiratory droplets when an infected person coughs or sneezes. Influenza virus undergoes frequent genetic mutations, which can lead to the emergence of new strains of the virus. Antigenic drift, antigenic shift, reassortment, and point mutations are all mechanisms by which the genes of the virus can mutate. The frequent mutations of influenza virus are one of the reasons why influenza vaccines need to be updated annually to keep up with the evolving strains of the virus. Influenza virus is categorized into different subtypes based on the combination of two surface proteins, hemagglutinin, H, and neuraminidase, N, that are present on the surface of the virus. There are 18 known subtypes of hemagglutinin, H1 to H18, and 11 known subtypes of neuraminidase, N1 to N11, which can combine in different ways to form different subtypes of influenza virus. Some of the subtypes of influenza virus that have caused significant outbreaks or pandemics in humans including H3N2. This subtype caused the 1918 Spanish flu pandemic, as well as the 2009 swine flu pandemic. The Spanish flu pandemic, which occurred from 1918 to 1919, was one of the deadliest pandemics in human history. It is estimated that the pandemic infected around 500 million people globally, which was about a third of the world's population at the time. The mortality rate of the Spanish flu pandemic varied between different countries and populations, but it is estimated to have been between 10% and 20% of those who were infected. As for 2009 swine flu pandemic caused significant concern and resulted in many illnesses, the mortality rate was relatively low compared to other pandemics. According to estimates from the World Health Organization, WHO, the 2009 swine flu pandemic resulted in between 123,000 and 203,000 deaths globally, which is significantly lower than the mortality rates of other influenza pandemics, such as the Spanish flu pandemic of 1918-1919. H3N2 virus. This subtype caused the 1957 Asian flu pandemic. The Asian flu pandemic, which occurred from 1957 to 1958, was a global outbreak of the H3N2 influenza virus. The pandemic caused significant illness and mortality, although the mortality rate was lower than that of the Spanish flu pandemic of 1918-1919. The exact number of deaths caused by the Asian flu pandemic is difficult to determine, but it is estimated to have resulted in the deaths of between 1 million and 4 million people worldwide. The H3N2 virus. This subtype caused the 1968 Hong Kong flu pandemic and is still circulating in humans today. The Hong Kong flu pandemic, which occurred from 1968 to 1969, was a global outbreak of the H3N2 influenza virus. The pandemic caused significant illness and mortality, although the mortality rate was lower than that of the Spanish flu pandemic of 1918-1919 and the Asian flu pandemic of 1957-1958. The exact number of deaths caused by the Hong Kong flu pandemic is difficult to determine, but it is estimated to have resulted in the deaths of between 1 million and 4 million people worldwide. The impact of the Hong Kong flu pandemic led to the development of more effective influenza vaccines and improved public health measures, such as increased surveillance and reporting of influenza cases. H5N1 and H7N9. The subtypes caused outbreaks of avian influenza, bird flu, in humans in Asia, Africa, and the Middle East, and H7N9 in China. The avian influenza, also known as bird flu, has caused several outbreaks in humans since the late 1990s, but a pandemic has not occurred yet. However, some strains of the avian influenza virus have been associated with high mortality rates in humans. One strain of the avian influenza virus that has caused concern is the H5N1 subtype, which was first identified in humans in 1997. Since then, there have been several outbreaks of H5N1 in humans, mostly in Asia and the Middle East, with a high mortality rate of approximately 60%. Another strain of the avian influenza virus that has caused concern is the H7N9 subtype, which was first identified in humans in China in 2013. H7N9 has a lower mortality rate than H5N1, but still causes severe illness and has been associated with a mortality rate of approximately 30%. It is important to note that while the avian influenza virus has caused significant concern due to its potential to cause a pandemic, the likelihood of a pandemic occurring depends on a number of factors, including the ability of the virus to spread easily between humans. It is also important to note that public health measures, such as surveillance, early detection, and rapid response, can help to prevent and control the spread of the virus in both humans and animals. H3N2 This subtype has been associated with sporadic cases of human infection, as well as outbreaks in poultry. There has not been a pandemic caused by the H3N2 subtype of the influenza A virus. However, H3N2 is a type of avian influenza virus that can infect humans and has caused sporadic cases of human illness, primarily in Asia and the Middle East. The mortality rate of H3N2 infections in humans is generally low, with most cases resulting in mild to moderate respiratory illness. However, there have been some reported cases of severe illness and death associated with H3N2 infection, particularly in individuals with underlying health conditions. It is important to note that while H3N2 is not currently causing a pandemic in humans, it is still considered a potential threat to human health. Now let's know in detail about the ongoing H3N2 disease. The H3N2 influenza virus is a subtype of the influenza A virus that has caused several pandemics and seasonal outbreaks of influenza in humans. The virus is a single-stranded RNA virus that belongs to the Orthomyxoviridae family. Influenza viruses, including H3N2, undergo frequent mutations, which can lead to the emergence of new strains of the virus that can cause illness in humans. One study published in the journal PLOS One analyzed the genetic evolution of H3N2 viruses from 2002 to 2012 and found that the virus had undergone significant genetic changes during this period, including the emergence of new antigenic variants that may have contributed to the reduced effectiveness of the seasonal influenza vaccine in some years. Another study published in the journal Emerging Infectious Diseases investigated the clinical and epidemiological characteristics of H3N2 infections in children during the 2014-2015 influenza season. The study found that H3N2 was the predominant strain of influenza circulating during this season, and that children who were infected with H3N2 were more likely to require hospitalization and to experience severe illness compared to those infected with other influenza viruses. The most common symptoms of H3N2 influenza are fever, cough, sore throat, runny or stuffy nose, headache, body aches, fatigue, chills, loss of appetite. Some people with H3N2 influenza may also experience gastrointestinal symptoms, such as nausea, vomiting, and diarrhea, although these symptoms are more common in children than in adults. In severe cases, hydrogen nitride influenza can lead to complications such as pneumonia, bronchitis, and worsening of underlying medical conditions. Young children, older adults, and people with weakened immune systems or underlying medical conditions are at higher risk of developing severe illness or complications from H3N2 influenza. What may be cause of H3N2? H3N2 viruses are zoonotic, meaning they can infect both humans and animals, particularly pigs and birds. Pigs are considered a mixing vessel for influenza viruses because they can be infected by both human and animal influenza viruses, which can lead to the emergence of new strains of the virus with pandemic potential. H3N2 influenza viruses are transmitted through respiratory droplets when an infected person coughs or sneezes. The virus can also be spread by touching a surface contaminated with the virus and then touching one's mouth, nose, or eyes. It is important to note that H3N2 is not the only strain of the influenza virus that can cause illness in humans. Other subtypes of the influenza virus, including H1N1 and influenza B, can also cause seasonal influenza outbreaks and pandemics. The management and treatment of H3N2 influenza typically involve a combination of antiviral medications and supportive care. Antiviral medications for H3N2. The Centers for Disease Control and Prevention, CDC, recommend the use of antiviral medications such as oseltamivir, Tamiflu, and zanamivir, Relenza, for the treatment of H3N2 influenza. These medications work by blocking the activity of the neuraminidase enzyme, which is essential for the replication of the virus. Early initiation of antiviral treatment, within 48 hours of symptom onset, is associated with better clinical outcomes, particularly in high-risk patients. Emergence of antiviral resistance. Recent studies have reported the emergence of H3N2 strains that are resistant to oseltamivir and other neuraminidase inhibitors. In such cases, alternative antiviral medications such as balozavir may be used. The emergence of antiviral resistance underscores the importance of continued surveillance and monitoring of circulating strains of the virus. Let's see the supportive care for H3N2. Supportive care measures such as rest, hydration, and fever control can help manage the symptoms of H3N2 influenza. Non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen or acetaminophen can be used to reduce fever and relieve pain. In severe cases, hospitalization may be required for respiratory support and other intensive care measures. How to prevent H3N2? Vaccination is the most effective way to prevent H3N2 influenza. The seasonal influenza vaccine is updated annually to include the strains of the virus that are expected to be most prevalent during the upcoming flu season. Other preventive measures include frequent hand washing, avoiding close contact with sick individuals, covering coughs and sneezes, and staying home when sick. Overall, the management and treatment of H3N2 influenza involve a combination of antiviral medications and supportive care measures, with early initiation of antiviral treatment being associated with better clinical outcomes. Vaccination remains the most effective way to prevent the spread of the virus.